As you get older, you fear those little fine lines and wrinkles, and it's something I'm sure we all think about from time to time. But we've got something today, this procedure, that's going to be inspiring.
Yeah, you know, and you think about it, when we talk about fine lines, you don't think about going to a dentist to take care of those fine lines around your mouth and all that.
Makes sense, though, because it's your mouth.
Yeah, it makes total sense. Injectable implants is what they're called, and joining us in studio right now is Dr. Michael Stern. Doctor, who's a wonderful dentist, and you've been at this for many, many years. You've got a lot of experience, but this is somewhat new for dentistry, isn't it?
It really, really is, Joe. And, you know, the dental board changed the rules. We were trained to inject people. That's what we do.
Right.
I have just found this to be the most fun thing I've seen and done in my entire career.
And if you're wondering what we're talking about, we're not talking about Novocaine somewhere on your face. All right. What
is it?
Yeah, injectable implants.
Well, let's just say that, you know, we already know about what can be done for the really fine wrinkles. Well, if you have a really heavy smile line here, or this is called a marionette line down here, we can have somebody come in and, you know, assuming that their medical history is okay, we can change that like in 20 or 30 minutes.
Does it hurt?
We are the experts at comfort. We are the experts at anesthesia. So we can numb people just like we do for teeth. You know how when you get front teeth done, part of your face gets numb? Well, voila. We just numb like we're doing a dental procedure. We can go in there and do whatever we need to do, and people are comfortable.
And doctor, this is FDA approved. And
FDA approved.
You just got the green light recently. I mean, how new is this?
Well, dentists have been doing this for a while in other states, but not in Ohio.
Excellent.
I think within the last year. And the stuff that we were trained on, I actually was trained in New York and also by somebody from California.
Let's look at some pictures.
Yes, because you brought pictures, and I think this is really going to be what tells the tale here. So talk about these, doctor.
Well, very simply, somebody came in, she had a big event coming up in a week or two. She just wanted to get rid of those lines from the nose to the corner of the mouth. So if we see the next picture, the next picture will come up, and that's like 30 minutes later.
Wow.
30 minutes later.
That's not
not retouched. She came in. Those of you with high definition, you can see that there's some bruise marks, a little bit of swelling.
Those are going to go.
And I believe we have another picture. This was down around about 5 weeks later.
Pretty impressive.
I mean, really is.
I mean, not that I would walk up to her and say, "Wow, those are deep lines you have," but I mean, seriously, they were pretty.
Yes, very defined.
Pronounced.
Yeah.
How long is the recovery? I'm just curious.
Well,
you said there's some bruising and stuff.
Holly, we tell people just 2 weeks.
Okay.
2 weeks, because some people can have some bruising, you can have some swelling, some redness.
Yeah.
So don't do it like the day before your wedding or whatever like that. But the reason it's called an injectable implant is this particular material, which is Radiesse from Merz Pharmaceuticals in Germany, was used in Europe for years. This is injected comfortably. No.
Yeah.
That's totally different.
Right.
But it goes deep below the layer of the skin, and it actually makes the body's own collagen sources do that. Generate more collagen for 6 months. You can get a boost for the first 6 months, and unlike some of these other materials, this can last like over a year.
Wow. That was going to be one of my questions, is how long it lasts.
12 to 18 months right now is what we tell people.
That's amazing.
It is. I love what you call them. All right, let's review the lines real quick. For just you know, you have these. What are these called right here?
Well, you can call them smile lines. We call them labial folds.
You said these are marionette
lines.
They look like a little ventriloquist dummy.
Yeah.
All right, now what about the ones around the lips?
Those are done with, and those are sometimes called smoker's lines. Those are done with a different material called Bellatero. That is done, again, comfortably while somebody's numb right below the surface of the skin.
You can do it right in the chair.
Quickly, you've got the special offer for yours today. Do you want to talk about that?
Yes, I do. If anybody wants to call and mention they saw us on TV3, we'll give them a free consultation. We'll also give them 25% off any of our services.
Excellent.
And that does include stuff like Botox, which can also be used for migraine therapy. It was approved for migraine therapy.
Look out, Matt Grano waits to save. He's going to take his gig. It's a great deal.
Dr.
All right,
Stern, thank you so much.
If you want more
Thanks
information,
so
there it is right there in front of you, 975-8444, smilebrighter.info.